Serving the forgotten. It's an inspiring subject, but there are many, many people with felt needs around the globe. When we speak about forgotten people, it brings up images of children in distress. It brings up images of elderly without any hope. But there are many, many needs. And so in order to serve the forgotten, we need to identify who are those people in greatest need. Because our resources are limited, our time is limited. And so how do we identify the world's most forgotten people? Well, we look at quality of life. How do we measure someone's quality of life? It's an intriguing question. One of the most fascinating answers to that is the Human Happiness Index. Now, this was developed in Bhutan, a little nation north of India. And what they do in the Human Index Happiness is simply ask people to rate on a scale of 1 to 10, how happy are they? I'm sure that all of you could do that right this moment. How happy are you? And in terms of happiness, what nations in the world are the most lively, the most upbeat? Actually, Bhutan, where the index was developed, and Western Europe and North America self-rate their happiness as very high, while those in Southern Africa and in Southern Asia, not so much in terms of human happiness. But if this is a bit too subjective for you, there's another scale. The Economist magazine developed the Quality of Life Index, and they look at actually 9 parameters. They look at life expectancy and at income. They also measure gender equality, political freedom, geographic location of the country. And using these kind of parameters to measure quality of life, what nations do you suppose have the very best? Well, I'll give you a hint. Number 1, highest quality of life in the entire world is a country that is so popular in the United States, we celebrate their holiday. Next month, we're going to remember St. Patrick's Day. Ireland is the highest quality of life nation in the world, followed shortly by the other nations of Northern Europe. Now, the United States comes in at about number 17 for worldwide quality of life index. And then by contrast, what countries do you suppose have the worst quality of life, the hardest lives, measured objectively? It's actually Zimbabwe with the very worst quality of life, nation in Southern Africa, and Haiti. Coming in really close are the stands, Turkmenistan, Uzbekistan, Kazakhstan, the former Soviet republics. That is the region of the world which is almost entirely ignored economically, spiritually, educationally. Nobody cares about the stands. They're too far away. They're too different. And that is a challenge for us to consider the needs of the stands. Now, the third way of measuring quality of life is called the Human Development Index. This is the one that is used throughout the United Nations, throughout the World Health Organization, and it's based on just 3 measures. And in terms of human development, North America, Western Europe come out with the highest scores, and again, Southern Africa, Southern Asia with the very worst scores. Now, Human Development Index only measures 3 parameters. It measures life expectancy, how long do people live, income, how much do they make, and literacy. Can they read? Can they function? Now, the reason they chose these 3 parameters is because they're very measurable. It's very hard science. We can measure how much money someone makes. It's really difficult to measure their scale of political freedom by contrast. And so let's look at these one by one. In terms of life expectancy, at this very moment, it's greatest in North America, in Western Europe, Australia, and it's very least in Southern Asia and Southern Africa. But the trends are actually pretty encouraging. If you look at the history of the last 100 years, life expectancy on every continent has been going up sharply, except for Southern Africa. It plateaued in the 1990s. It actually went down. People were living less years than before. What happened in Africa in the 1990s? It was HIV and death from tuberculosis, and complicated by corruption and social chaos and wars, which made efforts to relieve HIV and tuberculosis even more difficult. Let's take a look at economic output, at GDP. Snapshot of the world right now, of course, those same regions of the world, Southern Africa, Southern Asia, have the very lowest income. Poverty is correlated with quality of life in many, many different ways. And if I show this to you graphically, if I show the size of the continent to indicate the amount of economic productivity, the world looks like this. The Northern Hemisphere is very large and fat. Each country is putting out a lot of income generated, while the Southern Hemisphere is very, very narrow and skinny. Relatively little economic output in those regions. And then if we look at the trends, over the last 200 years, economic output in North America, Japan, Western Europe has gone up very steadily, while that of Africa, Latin America, and Asia has been almost flat. Now, of course, China is giving Asia a bit of a bump, but aside from the China phenomenon, not a lot of economic growth in that part of the world. And then finally, the third parameter in Human Development Index is literacy. Can people read? And so their ability to read is highly correlated with their ability to get a job, to earn money, to take care of their physical health. And so there are still regions along the equator, especially, where literacy is a significant problem. Consider this question. Economic development and health are really closely linked together. Stronger economic conditions foster greater physical health through all of these ways, except which one? Better water and nutrition, better medical services, better education, incentives to increase childbirth. Well, actually, all of these promote better physical health except for incentives for increased childbirth. As economies grow, there's less pressure for women to have lots of children. And the children that they do bear are generally much healthier. In fact, families with 6 children have a much higher probability that their children will die than families with just 2 or 3 children. And so economic growth is also connected with better health for women and for their children as well. Now, we've seen disasters in recent years that have highlighted the particularly grave needs of people that are living in low-income areas of the world. So we had Hurricane Harvey just here in Houston that primarily affected low-income people. We saw what happened in New Orleans with Katrina. It was the poor of the city who were not able to get out, and some 2,000 of them died. Not to mention Port-au-Prince and what happened in that country. And so disasters have shone a light on the need of such people. Impoverished people are also much more likely to suffer from diseases. So we track what happens with particular infections like Ebola. But then did you know that last summer in West Africa, there was a meningitis epidemic that killed 2,000 children within 2 weeks? Now, that never made it on the news. We're consumed with other things. But it is the forgotten of the world who are much more likely to die. Women die in childbirth still, about 500,000 women a year around the globe. And 98% of them are in a low-income country. They're in a place where there is no doctor, there is no obstetrician, there's not even a birth attendant to help them with their complications. And conflict and refugees. At this moment, 70 million people, the population of the entire southern states of the U.S., are living as refugees, forced from their home due to fighting, due to natural disasters, due to persecution. This is an exceptionally mobile world that we live in today. Central Americans fleeing northward, fleeing poverty and violence. We have West Africans fleeing Boko Haram, who kidnap their daughters and make them slaves. We have East Africans fleeing from al-Shabaab who kidnap their sons and force them to be soldiers. In Myanmar, there is the ethnic cleansing of the Rohingya people, essentially expelling them from the country, and they fled eastward toward Thailand and westward toward Bangladesh, to say nothing of the catastrophe in the Middle East at this very moment. These are problems of truly biblical proportion. Remember the history of the patriarchs. Jacob was living in the land of Canaan, and he was hungry. Jacob heard that there was food in Egypt, and so he sent 2 sons to find out if this is true. Jacob's sons returned, and they said, "There is food and there is an invitation to come live in Egypt." And so Jacob took his family, about 70 persons, and they moved down into Egypt. What happened? A new Pharaoh came to power who did not know Jacob, and instead he pounced upon the Hebrew people. He enslaved them. They did forced labor for the Egyptians for 430 years. And then under Moses, were brought out back to the land of Canaan. Scripture is replete with admonishments like Leviticus. When a foreigner resides among you in your land, do not mistreat them. The foreigner residing among you must be treated as your native born. Love them as yourselves. For you were foreigners in Egypt, and I am the Lord your God. This is a timeless principle for today. And let's not neglect those on the margins within our own cities, within our own societies. When you think of forgotten people in Houston or Kansas City or Los Angeles or New York, who comes to mind? Often it's people who are homeless, people with intellectual disabilities, veterans, non-English speakers, immigrants. Everything we talk about in this session applies on behalf of the forgotten within our own societies as well. When you look at the United States, especially in the South and in the West, great swaths illustrated here in red of people live in poverty. In fact, these are counties where over 2/3 of the citizens are registered as living below the poverty line in our own United States. Now, much of my experience is in the nation of Angola in southern Africa. Angola is best known for its longest running civil war in African history. It started in 1961 and it ran until 2003. And during that time, it was a country with no functioning health system. All the hospitals were gradually shut down, no functioning schools, money was worthless, and more landmines per person than any other country in the world. And you know what goes along with that? More amputees per person than any other country in the world. Princess Diana was in Angola highlighting the travesty of landmines just before her own death. Now, in the context of Angola, I was invited by a coalition of churches to help provide some kind of humanitarian relief. I was joined by 2 Swiss physicians, and we had a hospital with about 150 inpatients and about 600 outpatients every day. How do 3 doctors do that? Well, they don't. Actually, we saw our role as primarily equipping our Angolan brothers and sisters, our Angolan nurses, our Angolan physicians with the skills they needed in order to care for their own. And along with that, to be encouragers to them as they press forward in this extremely difficult road. Now, in Angola, we did care for some people who were shot, some people with landmine injuries, but the reality is that most of those people died before they made it to the Kalukim Hospital. And instead, what we saw was the diseases connected with war: measles, malaria, malnutrition, diseases for which we have readily available treatment, readily available prevention, but not with a war going on. You have to have infrastructure to vaccinate people against measles. You have to have infrastructure to give people medications to prevent malaria. And yet this is what we were confronted with. Now, the war escalated in Angola. After just a couple of years, I was forced out, and I came back to the University of Missouri, where I began teaching public health and international medicine, and I was approached by all these young people, young healthcare professionals saying, I want to do that too. How can I get started? I want to follow the kind of lifestyle that you've been doing, but I've got questions. Like, how do I choose a particular community to serve? It's a really big world. Do I need to learn a language? What organization should I cooperate with? What do I do about my financial debt? How do I find a husband or wife who wants to do this kind of work? And it's for these reasons that in 2003 we launched the Institute for International Medicine, better known as INMED. We're a training center equipping people with the particular skills they need to serve the forgotten. And in my role at INMED, I teach courses, I arrange for international field experiences for our learners, and I also continue to serve in Angola every summer. I want to give you a little snapshot of our world's forgotten through the eyes of 4 individuals. And let's begin with Maria. She arrived at our CML hospital in Angola last summer complaining of some pain in her jaw. It was hurting, it was getting swollen, she began having fever, and when I examined her mouth, her teeth were rotten and broken, and she had a dental abscess. Well, that abscess grew, and the infection spread into her blood. She became septic, and Maria died in 2 days from a dental abscess. Now, dental care is not simply cosmetic. It's not simply elective. Dental care saves lives. And yet, throughout the low-income world, there are no dentists. It is one of the great, great opportunities and needs among these people. Next up is Marcelo. He's 5 years old. His parents brought him to me because he was breathing fast and coughing, and he'd just been sick for 3 or 4 days, had a little bit of fever. And when I examined Marcelo, clearly he had pneumonia. And so I did an x-ray, and when you look at his x-ray that I'm holding up to a window here, you can see in the right upper chest, it's white and fluffy looking. That is infection. That should not be there. His lungs should all look black. Now, Marcelo is in danger of dying of the leading cause of death in poor countries. What is the leading killer of poor people throughout the world? It's pneumonia. And there's nothing exotic about pneumonia in Africa or Asia compared to the United States. It's caused by the same microorganisms, and it's usually very easily treated, which is what we did with Marcelo. We gave him some amoxicillin, we supplemented him with some oxygen, and after just a few days, Marcelo was able to go home again. Consider this question. 70% of all childhood deaths in the world are due to which one of these? Almost all childhood deaths, they're due to malnutrition, due to an infectious disease, due to a vaccine-preventable disease like measles, due to a respiratory disease like asthma or pneumonia, or due to trauma, some kind of injury, a fall, a burn. Well, who's interested in pediatrics? You need to know the answer to this question. 70% of all childhood deaths are due to some infectious disease. And what are the 5 big infectious killers of children? Measles, malaria, tuberculosis, pneumonia, and diarrhea. If you master the prevention and treatment of those 5 diseases, that is going to be by far the majority of sick children that you will care for throughout the globe. Antonio was brought into the clinic because he was falling a lot. He was stumbling around his house, and when I took a close look at his eyes, you can see inside his pupils, it's white when it should be clear. Antonio is suffering from cataracts. Now, here in the United States, an eye surgeon could take him and in 20 minutes remove his cataract and put in a new lens, and Antonio would leave being able to see. In the entire nation of Angola, we have one eye surgeon who does cataracts. Only one for 20 million. And so, for lack of a 20-minute surgery, Antonio must be guided around by his neighbor for all the days of his life until maybe someone like you, learns to be an eye surgeon and can go and provide him that life-saving operation. And then there is Marcelinho. He was herding his cattle, and one of his calves fell into a ravine, and Marcelinho started climbing down to retrieve the calf, and he slipped. He injured his leg. And so when they brought him into the hospital, I saw his deformed leg, and I did an x-ray, and it shows this fracture right through the middle of his femur. Now in this city, he would be brought into any medical center, and a rod would be put down along his femur, and he would be up walking within hours. We don't have that technology in rural Angola, and so we treat femur fractures the same way they did during World War II. We put him in traction. And so he'll lay in bed with his leg extended for 8 to 10 weeks while that bone is healing. And then during that time, what will happen to the rest of his body? Well, his muscles will all atrophy. You know, we're able to walk and to run because we do it all the time. We train ourselves. But laying in bed for weeks, it will take him months in order to learn to walk again and to regain his strength. Forgotten people, a face on the plight of the forgotten. And so at this point, the question is, what can healthcare professionals possibly do on behalf of people like this? Life is not simply about being happy. If we make happiness our goal, that subjective feeling of feeling good, we may be missing entirely the plight of people on the margins. Instead, let's consider this scene. Christ is about to leave the world, and he's giving final instructions to his disciples. There's earnestness in his voice, and he's describing the end of the age, the end of the world when all people are gathered before him. And some of them, in one group, he says, "Come, for I was hungry, and you gave me something to eat. I was thirsty, you gave me something to drink. I was a stranger, and you invited me in. I was sick, and you looked after me. I was in prison, and you came and visited me." And then the scripture describes this sort of surprised sentiment among the people who are listening, and they say, "Lord, when did we see you sick? When did we see you hungry, thirsty, imprisoned?" And the king will reply, "Truly, whatever you did for the least of these brothers and sisters of mine, you did for me." What will we do on behalf of the least of these? How can we improve their lives? Well, let's come back to this Human Development Index. We want to increase their physical health, increase their economic income, increase their literacy. All of these work together. When people can read, they can get a better job, they can afford better health care. When people have better income, they can learn to read, they can afford better health care. All of these pieces flow together. About the time I moved to Angola, my colleague from Fort Worth, Dr. Lonnie Ackerman, moved to Nepal. Now, a young, energetic family doctor in Nepal. What do you suppose she would do? What would be expected of her in an impoverished, mountainous nation like Nepal? Well, that's not what she did. The first thing she did was actually open a school, a primary school. Because Dr. Ackerman recognized that unless children have an education, unless they can read and write, there is no way that they can afford better health care, afford better housing, afford better nutrition, all of the things that they need to live healthier lives. And so after a few years of opening primary care schools that essentially focused on girls, of course, because those are the ones who are often not allowed to participate in any kind of education, well, her girls were getting older and they needed jobs. And so Dr. Ackerman opened up a vocational training school, teaching them mechanical skills and textile skills so that they could earn an income and be able to afford the kind of housing and nutrition and medical care that would make for long, healthy lives. Now, she also saw some patients, but she always did it in conjunction with Nepali colleagues, where she was showing them how to care for this person with a sore throat, or this child with pneumonia, or this man with a broken leg. Most of the world does not have access to physicians. And in place of that, what many countries provide is called community health workers, or village health workers, or promotores de saúde, people who have been given a several-month training in order to manage the most basic kind of health problems. And these are the individuals that Dr. Ackerman was primarily trying to equip while she was doing this. Now, that's just one example of someone taking a comprehensive approach to serving the forgotten. What will you do? There was a time when you dreamed big. Maybe you still dream big. Maybe that's why you're here today, because you're dreaming big. You have a vision. You want to find a cure for HIV. You want to find a cure for coronavirus. You want to show compassion to children who are on the streets. It is life-giving to have that kind of virtuous mission. Be encouraged. Hold on to that. Marcy Coons is a young physical therapist who came to me at InMed and said, I've heard about disabled children in India. I want to do something on their behalf. And so InMed arranged for her to go work in India with an Indian physical therapist. And she describes it as, while I was in India, I grew confident in crossing the divides of culture and more assured in my conviction to provide care for people in greatest need. Caring for disabled children in India was a dream come true for Marcy. Your dreams can come true as well. Now, to get there, you may need some skills. If you want to care for neglected, marginalized people, you may need to refresh some skills. Those of you in medicine, it may have been years since you delivered a baby or sutured a wound or set a fracture. You might need a refresher on that. Those of you who have an interest in prevention, you may need to refresh your skills on how do we make water safe to drink, what kind of nutrition is recommended given the particular economy and agriculture of your country. You may need to learn a language. Now, for adults, that's a serious undertaking, but if you are going to be credible over the long term in a country that's not English speaking, then make the commitment. Language learning can actually be loads of fun as well. Health leadership also might be required. You and I are usually taught very carefully how to care for people one by one. We do a history, we do a physical exam, we create an assessment, a personalized intervention plan. That may not be possible when there are hundreds or thousands of people who need your attention. And so you'll have to instead train others to do that. Motivate others to do that. Give other people the equipment and the organizational capability to multiply your own skills to benefit those people. Maggie Higgins is an InMed student who was in Haiti when the earthquake struck. She learned skills that she was not expecting. She says, I learned to care for nasty crush injuries, most importantly, to see such pain and death and continue giving it all. Then, what's holding you back? You've got the dream, you've got skills. Now, what will push you over the line to actually taking action? There's so many things that could be doing it. You might be concerned about being professionally challenged, being pushed outside of your comfort zone, asked to do things that you forgot to do or you never learned to do. You may be financially challenged. You will not become wealthy caring for forgotten people. That is reality. It's an exchange that you're going to have to make if this is your career intention. What about physical safety? What's the chance of you going somewhere and becoming injured or becoming infected as part of this? Now, you will take precautions, but it is part of the calculated risk. One of the biggest questions might be, can I really make any difference? What if I invest all of this time and talent and serve forgotten people, and yet I don't see any change, I don't see any improvement? But there will be individuals whose lives will be dramatically impacted by you. And so focus in on those particular people that you know you're impacting. Now, one person who overcame all of these obstacles is Mark Byler, family physician from Kansas City, who took his young family 15 years ago and moved to Zimbabwe. Now, you remember Zimbabwe, the country with the very worst quality of life in the entire world. He intentionally went there. Half his patients have HIV. Half his patients have tuberculosis. And he's trying to care for them in a setting where they just don't have a lot of resources. They don't have a lot of drugs. They don't have a lot of staff. Every day is a struggle. But it's part of his conviction to do something within his capability on behalf of the world's most forgotten. Consider a few questions. What is your dream? What is it that you want to do on behalf of the world's most marginalized? And then what's holding you back? What's the obstacle? And how will you overcome that? To press on, to make that dream into a reality. Because ultimately, in our lives, it's not simply about happiness. It comes back to that conviction that Christ described, saying, I was hungry and you gave me something to eat. I was thirsty, you gave me something to drink. I was imprisoned and you visited me. I was sick and you cared for me. I was a stranger and you invited me in. In that kind of life and lifestyle and profession, may we find the greatest happiness.